Let me know when you're ready. Good to go. Good morning. We're coming to you today from Caboolture, where we have a very exciting announcement about how we will manage the massive population in this area in the future. But first of all, I'm happy to provide the COVID update for Queensland. Then we have the Deputy Cho who can address that, and then the State Planner, Kerry Doss, and Christy from the UDIA to talk about the announcement. There is just one new case of COVID-19 overnight in Queensland. A returned traveller was identified in hotel quarantine on the 5th day after their arrival. They had been in Papua New Guinea, where we know they're struggling with a large number of cases. We did 10,478 tests in Queensland in the last 24-hour period. We tipped over 85% first dose vaccination across the state, which is a fantastic result. 85.01%, 74.07% of Queenslanders have had their second dose. We now just have 3 active cases in the state, which the acting Cho described on our text exchange this morning as bloody amazing, which I think is a medical term. And it's now 14 days since we last had an infectious case in the Gold Coast community, meaning we can breathe a sigh of relief there. I just want to clarify and confirm the arrangements for the freedoms that we're providing to vaccinated people once we achieve 80%. And while we have said that the date for the border opening will be floating and will be based upon the point at which we do achieve 80%, we've had significant feedback from the business community that with regard to the freedoms for vaccinated people, it would be much simpler for them if that was a fixed date. And so we are confirming that that will be the 17th of December. This will allow businesses to prepare for the implementation of those new rules, those new mandates. It will also be fairer for people who got vaccinated on the basis that they had 3 or 4 weeks in the lead up to the 17th of December. It would have been quite unfair if we'd moved that date and then they had a period of time where they couldn't enjoy those freedoms. So we can now be very clear that while the border opening will be when we achieve 80%, and that may well be sooner than the 17th of December, the mandates for vaccinated and unvaccinated people will come into effect on the 17th of December. Can I also just take a moment to comment on and address some of the commentary regarding the cost of PCR testing. And we welcome confirmation overnight from the Federal Health Minister that the Commonwealth will continue to contribute to the costs of those tests in other states. That will mean that people travelling to Queensland will be able to get free of charge PCR tests before they come to Queensland and meet that requirement. That will be under the exact same arrangements that we have always provided here in Queensland for people who needed to get tested before travelling to other states, for example, Victoria and South Australia. I note that Greg Hunt says that was always been the case. Of course, it would have been nice if he'd clarified that sooner. I just urge you to go back and see where these stories were coming from. Given the number of federal MPs who commented on it, I suspect it was another backgrounding campaign from them to distract from their own leadership tensions. Just yesterday, Greg Hunt was saying we should drop the requirement for a PCR test. I had to comment on that yesterday morning, and by yesterday afternoon he was clarifying that PCR tests would be free for people travelling to Queensland. We welcome that confirmation. It's good news. We just wish it had come a bit sooner. Finally, moving on to the reason we're in Caboolture today. Just west of here in the new growth area of Caboolture West, we are planning for 30,000 new homes, 70,000 people. Caboolture West will be the largest greenfield development in the state, and we're planning for it now, including planning for up to 8 primary schools, 4 secondary schools, new transport links, new health infrastructure. And today we're announcing that we are preparing new laws to give the state the powers that we need to deliver on that planning, to embed structure planning in the planning laws for our state. Caboolture West, to give you a sense of its scale, will have a population similar to the city of Mackay. And so under these new laws, we will have the power to officially declare priority growth areas like Caboolture West. It will allow us and give our state planner the powers required to coordinate that development to ensure that we deliver infrastructure to people moving into their new homes in Caboolture West, including green space. Caboolture West alone will have 70 hectares of green space, upgraded roads, footpaths and cycleways. After this press conference, I'll be joining the Moreton Bay Regional Council for their council meeting, and I certainly congratulate them and the Mayor for how collaboratively they're working with us to deliver on this vision. And finally, I just want to give a shout out to Regan. Regan's a grade 6 student here in Caboolture. He spends all of his spare time collecting bottles and cans for our container refund scheme, and he uses those funds to do good works. For example, at the moment, he's putting together Christmas packages for kids in foster care and for young people in hospital. Regan does a great job, and it was lovely to have a coffee with him this morning. So now we'll go to the Deputy Chief Health Officer with
Thanks, Deputy Premier. As Deputy Premier said, there's only been one new case, which is great news, overseas acquired and travelled recently from Papua New Guinea, but was not infectious on the flight. And so that brings us to a total of 2,115 total cases for Queensland. And as mentioned, 3 are active cases only, which is the lowest number we've had for all of 2021. And the Gold Coast cluster is officially ending today, as there have been no more cases in the last 14 days. We have reached that very exciting milestone of 85.01% people having had their first dose of vaccine. And I'd just like to continue to encourage people to please go and get your vaccination if you haven't done so yet. There's still plenty of availability of vaccine, plenty of places open where you can get that done in the mass vaccination centres, at general practices, at pharmacies, and you have a choice of vaccines, so that's great as well. I would also just remind people that if you have any symptoms at all, please do go and get tested. Testing remains a really important part of our protection, our ability to identify a case really quickly so that we can respond fast to limit any spread in the community. So please do get tested if you have any symptoms at all. And don't forget to use your Check in Queensland app everywhere you go. That will help us to know if there is a case and quickly contact people who may have been exposed so we can limit the spread in the community. Thank you very much.
Kirsty Cheshire-Brown from UDIA Queensland. Well, UDIA Queensland welcomes the announcement from the Deputy Premier this morning on the ability of the state to declare priority growth areas following the introduction next year of amendments to the Planning Act. UDIA has been calling for the government to undertake more state-led structure planning, and this will be particularly important as our state continues to grow and we develop new communities. There are, of course, challenges currently with delivering land to market across the state, particularly around land fragmentation, of course, the coordination of infrastructure at both state and local government levels and utilities. So we really hope that the progression of these amendments to the Planning Act will enable us to get a head start on planning some of those critical transport connections, education facilities, hospitals and health facilities. So it's obviously great news for the industry to allow our industry to get land to market much more efficiently. And of course it's wonderful news for the community to rest assured that we're able to plan and proactively plan all of those things that we consider that make up a wonderful community. So UDIA Queensland looks forward to working with the government on the progression of the bill, and we strongly welcome the DP's announcement today. And of course this is just incredibly important given the growing nature of our state, the fact that we're continuing to have to accommodate a growing population and the challenges that that brings with it. And of course we all want to keep a lid on housing affordability.
Any questions?
Premier, why didn't the Premier clarify days ago that you could use a negative test on your phone to prove that you were negative instead of needing a certificate?
Oh, look, I understood throughout that a text message, evidence of a text message was going to be sufficient. I understand that's what police have required in the past and will be the case going forward.
Why didn't the Premier say that then until yesterday? Friday we were at that press conference and the Acting Chief Health Officer said that we're looking at making it free or we're looking at a solution, and we were still talking about the cost then. Why wasn't it clarified earlier?
As I said, I'd urge you to go back and work out where these stories were coming from. There was clearly an orchestrated campaign to confuse people. We have all along provided PCR tests here for people travelling to other states. We were presented with claims that other states were charging for those fees, and we were asked to confirm whether PCR tests would still be a requirement, and we said that they were. Evidence of a PCR test will be sufficient, and a text message will be sufficient to prove that you've had a negative PCR test.
The issue with costs, though, the federal government, the health minister has said that their advice hasn't changed, that they agreed in March 2020 that they would cover half of the cost of these tests. So why are you saying now that it was announced last night that they would agree to the funding? He
said that last night. Yesterday morning, he was saying we shouldn't require a PCR test. That was his position.
Yeah, but the issue of cost was never up for, it hasn't changed. So why was it being floated by the state government that it was going to cost people?
No, we never floated that. There was never an announcement from the state government that it would cost people. We were asked whether people would need the test, and we were presented with the argument that in some cases that would cost people money, and we said they would still require that test.
So at no point you thought it would be appropriate over the last 5 days to clarify and explain to Queenslanders that you could use a text message?
Look,
it's the federal government's
what I said very clearly at press conferences like this one is that we don't control the testing arrangements in other states. We do control the testing arrangements in Queensland, and we've always provided tests at our clinics for people who need them to travel to other states, and we urged the Commonwealth to clarify, to ensure there are arrangements that would allow people in other states to get those tests before they travel here.
So just to clarify now, just to put the issue to bed, can we take the opportunity now to clearly explain to people what they will need, what testing they will need, what proof is required, what will it say on the text that allows them to get into Queensland?
So anyone who's got a COVID test will have seen the kind of text message that you receive, provided that text is from a test within that 72-hour window. They'll be able to use that as proof of a negative test.
For the past week or so, yourself and the Premier and other state government officials have said that people will need to pay for it if that is what happens, and that at some points they've said that they'll need a certificate. That's what incurs the cost. What has changed between then and now for you to be able to stand here today and say that it will no longer cost?
Well, I think to be fair, it wasn't us saying it would cost people. We were asked whether people would need tests. You were all reporting stories saying that those tests would cost people, and we were asked if it still cost them, whether they would still need a test, and we said that they would. We welcome this confirmation now from the Commonwealth that the arrangements in other states will allow people to get those tests free of charge and travel here. That's what we've been asking for. That's what we've got now.
We're expected to hit 90% in early January, and we're obviously going to bring the border opening forward on current numbers. Why not just take the opportunity to remove the PCR tests and remove the confusion for people? Because obviously this mixed messaging this week's been incredibly difficult for people.
Well, I'll allow you to reflect on how useful the media reporting's been, but the tests that we have in place are an important part of our protective mechanism, an important part of throttling the rate of seeding between the 80 and 90% mark. And so we look forward to achieving those milestones, but these arrangements that we've put in place are important to keep Queenslanders safe, and we'll keep them there.
For the sake of accuracy then, can we clarify the Premier's comments yesterday where she said trips to Sydney, day trips are off the table until 90%? That's not in the roadmap, so why are they off the table until 90% double dose?
Oh, it's simply the practicalities of needing to have a negative test before returning here. So obviously you can't do a day trip.
It's beyond a day trip though, so it's a 3-day trip, isn't it, with the 72-hour testing requirement?
I know, if you get a test and get a negative result, you can return. So it's really about the turnaround then.
For people coming for Christmas, if they can't come for 1 or 2 days and if they can't go down to Sydney and come back. Do you understand why that's confusing to people? So are they technically banned from doing it, or they just shouldn't do it?
It's just the practicalities of needing a negative test before you can return here. The testing turnaround times vary state to state, clinic to clinic, but the requirement is that you have a negative test result before returning.
One Gold Coast accommodation provider told us that they had 50 cancellations last week due to the confusion around the PCR test. Do you think that the government owes them an apology?
We weren't writing these stories. You all were. And I'd urge you to go back and see the background of them, see where they were coming from. We were asked to comment on the requirement for a PCR test, and we said people would require a PCR test.
You say that you weren't writing the stories, but we were using your quotes. We were asking specifically what they would require, whether they would cost, and then were given answers that indicated that they would. So why didn't you take the opportunity to set the record straight?
We called on the Commonwealth to set the record straight. We don't do the tests in New South Wales. We don't do the tests in Victoria. We do the tests in Queensland. And we said we would continue to provide those tests in Queensland for people needing to travel to other states. And we urged the Commonwealth to provide the clarity that they have now provided, that people would be able to get those tests in New South Wales and Victoria.
But you set the rules and you write the roadmap, and you still didn't clarify if a text would be okay, and that is the clear issue here for people at home.
Well, we can clarify that a text will be sufficient evidence of a negative test.
Why did it take 5 days to clarify that?
Well, I'm not sure that did, but also these are arrangements that will come into place down the track, and we are now able to provide that clarity.
Does the state government plan to introduce a vaccine mandate for council workers, including councillors across Queensland?
There's no other plans at this stage. The plans that we've put in place are driving our vaccination rate up. That is good news. That means we can achieve those milestones sooner. Those rules are doing their job, and come the 17th of December, people who have been vaccinated will be able to have those freedoms, experience those rewards.
So we could have councillors across Queensland who aren't vaccinated. That would be fine.
So the arrangements we have in place are about getting to our goals of 80% and 90% vaccinated.
Just on the text message that people will receive, are you working with other governments to make sure that there's some uniformity within the text that they receive? Because we don't want people getting a text, say in New South Wales, coming up and finding out, oh no, you needed your birth date or something like that, and being turned away. Are we making sure there's uniformity in the language being used in the texts between the states?
This hasn't been a problem throughout. Police have always taken those text messages as evidence. So provided you go to a New South Wales Health or a Victorian Health, for example, clinic, the text messages that they provide will be acceptable.
If it's the federal government making the call on this, why is there confusion here in Queensland but not so much in other states?
Well, we had days and days of federal MPs feeding these stories, of reporting on these stories. The arrangements that we have put in place are very clear. People will need a negative PCR test before arriving in Queensland during that period after we achieve 80% vaccination status, which we now expect will be a little bit earlier than the 17th of December.
And now once we do open up, will we try and live like Sydney and Melbourne are? They're living with the virus despite having relatively high case numbers, specifically in Victoria. Is that how Queensland will run the state once we open, or will we still be looking at restrictions?
We should expect to see increased number of COVID cases after the border opens. It's not going to be possible to maintain that current level. We only have 3 active cases right now, so there will be more cases, but we'll continue to have some measures in place to manage the virus. Contact tracing will continue. Quarantine requirements for people who may have been exposed will continue. So there will continue to be some measures to control the level of the virus, as well as, of course, vaccination. It becomes our main tool, and that's why it's so important that we achieve those goals.
You've been left to come out here and clean up this mess today. Where's the Premier? Is she in hiding?
I was always scheduled to make a really important announcement here about Caboolture. I was scheduled to meet with the council. It was my turn to do the press conference.
Where is the Premier today?
That's a question you have to put to her office, but it's not unusual for me to be the Minister addressing the press conference and giving the COVID update. I've done a few of them now.
Just for the Deputy Chief Health Officer.
This will be the last question,
if
guys.
you could. So the border comes down on December 17 or earlier at 80%, and we know that the testing requirement goes at 90%. Is there health modelling about what that risk is in that 3 or 4 weeks, about why it's so dangerous and we need PCR tests for only that 3 to 4 weeks?
What we know is that at 80%, we still have about 20% of our population who are vulnerable, and so the testing requirement is to limit the risk to the vulnerable people of catching the virus.
So just one last question. We've heard of a couple from Miles who have crossed the border on an exemption to work on the farm. We've spoken to them and they've said that their 3-year-old wasn't granted an exemption because, unsurprisingly, a 3-year-old isn't an essential worker. Are you aware of this case?
I'm not aware of that case, and I can't obviously comment on individual cases. Happy for them to contact us again through 134 COVID if they've got any questions and to address their issues directly.
I suppose given that they've got a 3-year-old essentially stranded, will you be making the effort to get in contact with them now that we've brought it to your attention?
We would obviously need to be able to identify them. Happy for them to contact us. As I said, we're happy to talk with them and see what we can do to help, as we always do try to. Thank you.
Very good. Thanks, everyone.
Thank you.
This way? Okay.